Welcome to my channel. The first group of medications that I'm going to talk about are medications that are used to treat a variety of diseases related to stomach acid production. This group includes antacids, histamine receptor antagonists, known as H2 receptor blockers, and proton pump inhibitors. Antacids are over-the-counter medication that help neutralize stomach acid. They don't block the production of stomach acid. They can be taken by unexpected heartburn. They work very fast on contact, and the effect lasts for up to 2 hours. Antacids are typically safe for most people, and they should be taken as directed to reduce the risk of diarrhea or constipation. Patients with certain medical conditions should consult their doctor or healthcare provider before taking certain antacids containing aluminum hydroxide or magnesium carbonate. Antacids may increase the risk of developing sensitivity to certain food. Therefore, it's important to know that many side effects comes from not taking them as directed. The second group are H2 receptor blockers that are used to relieve and prevent heartburn, indigestion, and sour stomach. H2 receptor blockers decrease the amount of acid produced by your stomach by blocking histamine receptor in your stomach. Tolerance has been reported upon long-term use of H2 receptor blockers. One study which was conducted by Rakoff argued that hypergastриnemia is induced upon long-term therapy with H2 receptor blockers. H2 receptor blockers are available by prescription and over the counter. They start to relieve heartburn symptoms in 15 to 30 minutes, and the effect lasts for up to 12 hours. What you need to pay attention to if you are taking H2 receptor blockers is that smoking decreases the effect of H2 receptor blockers by increasing the amount of acid produced by your stomach. Another thing to pay attention to is drinking alcohol while taking H2 receptor blocker may increase the absorption of alcohol and lead to a heightened level of intoxication. Last but not least, I would like to talk about proton pump inhibitors. Proton pump inhibitors are among the most commonly used medications worldwide. The development of proton pump inhibitor have revolutionized the management of acid-related diseases. Unfortunately, this has led to their overuse and inappropriate use. When used appropriately, the overall benefits significantly outweigh the potential risk. Proton pump inhibitors are available by prescription and over the counter. Proton pump inhibitors inhibit the gastric acid secretion by binding covalently to an active proton pump on the parietal cells in your stomach. As proton pumps recycle periodically, it may take a few days to achieve a full effect, and their duration of action is slower than H2 receptor blockers, and the effect lasts for up to 24 hours. As proton pumps becomes activated during meal, it is recommended the administration prior to food intake to increase the efficacy of the drug. And for this reason, it's recommended first thing in the morning when taken once daily. Any medication can cause side effects. Fortunately, side effects from PPIs are rare, and nearly all adverse effects occur among patients who receive long-term therapy. Long-term PPI therapy may lead to malabsorption of minerals such as calcium, magnesium, and iron. If calcium supplementation is required, calcium citrate formulation should be considered rather than calcium carbonate to increase the absorption. Although rare, PPI may lower magnesium to a level that is not really easily replenished by supplementation, and it is only corrected upon discontinuation within 1 or 2 weeks. Another side effect which was associated with long-term PPI therapy was vitamin B12 deficiency. When vitamin B12 enters your stomach, it is bound to a protein molecule, R factor. The release of vitamin B12 from this protein molecule is activated by protease in an acidic environment. Another side effect which was reported is increased infection risk. One hypothesis suggests that the decrease of acidic environment may lead to bacterial overgrowth. Indications that require long-term PPI therapy are limited. Therefore, it's important to make sure you are only taking medications that are necessary to maximize benefit and minimize side effects. OTC products shouldn't be taken for more than 2 weeks unless there is an ongoing indications. For this reason, you should routinely discuss your medication list with your doctor.